they're used for both nasal and oral gastric tubings. Okay, when do we place these
Innovation.
innovations? What else? Gastric distension. When do you anticipate gastric distension?
BBM.
Just overventilating, right? So anytime you're like, yeah, well, anytime you're like, you're ventilating a patient for a long time, these are a good indication that you don't have to wait for the gastric distension, okay, to happen. This is just someone that you've been bagging for a good minute, and the repercussions of ventilating with a BVM, despite your greatest technique on jaw thrust, head tilt, chin lift, seat grip, the way the anatomy is, you're going to have some air leak into the esophagus, okay? Particularly in pediatric patients. Why pediatric patients?
Because they're belly breathing.
Belly breathers, and their airway's a lot more narrow. They don't have all the structures that developed yet. They don't have all the adipose tissue that adults have too. So they're a lot more prone to having oxygen leak into their stomach, okay? Pretty much these comes in a bunch of different sizes. You can find the sizes at the top of the packaging. 12, 14, 18s are your most common ones. And then there's agencies out there that have 8 and 10s, okay? Falk does carry 18s, the city side. And yeah, that's pretty much it. Do you know where to find the appropriate size for like a pediatric patient?
In 104? Oh.
In PDC. So in your PDC, you have a protocol book? Anyone have a protocol book? So just go to the PDC, you can find it at the top of the page, right? You measure with the LBRT, and then you can find at the top of the page the appropriate size. Do you know where to find the appropriate size for, say, can you use this in an eye gel?
Yeah.
I feel like a 12.
Yeah, so the appropriate sizes are also found in your skills here, and the skill list itself.
In 104?
Yeah, you can also find it like in the eye gel skill itself. So like right there, where my finger's at. See that?
Yeah.
So it gives you your OG size, or your eye gel size. You measure that off of their kilograms, and then right next to it is 12, 12, 14. Cool. And then on your pediatrics, when you get the right color, it'll be at the top listed right here. NG size, okay. 5. That one says 5 to 8. We don't carry 5s. Most agencies don't carry 5s, so that would be in order to use a different size or cut the length, okay. When you're measuring the tube, do you guys know where to measure it from?
From the nose down to like
To the side.
Yeah, so you'll take the end, go to the Zyphord process around the earlobe, and then either from to the mouth or to the nostril that you're entering, okay? And then you'll just mark it there. You can put a piece of tape there, or just try to remember what landmark you're on with the number nearest to it, okay? When you go in, you're gonna filter it in. If you're doing the nostrils, it's kind of similar. Just remember the septum right here goes up and then it turns and goes down, right? So just like an NPA, when you put an NPA, you turn it 180, you face the bubble up, you put the NPA up on the left nostril, and then you turn it 180 to go into the arc, right? Right nostril just goes into an arc. That's just how an anatomy is, okay? So just be prepared for that. You can put some lube on this at the end. There's a bunch of holes right here. They just pulls air when you guys are when you turn the suction on and you hook it up, and that just grabs air from this on. You're gonna get one of these syringes that comes in the package. It's a 60 ml syringe. Do you guys know what this is for in this terms?
To hear the sounds, stomach sounds?
And hear the sound. So how do you? What would you do necessarily with this?
You pull it back and then attach it, and
How much air do we draw?
30.
Yeah, about 30 or 40, right? So you don't want to push so much air into the stomach, because that's what we're trying to eliminate with this skill, right? So about 30 cc's of air. There's a cap here. This is how it comes, and then there's like a blue cap somewhere. And then these packages come with this. This blue cap comes up here on the top. So you'll just take this cap off, draw your air, hook it to here, and then now what are you listening to?
the gurgle,
Where?
like air in the stomach.
Right, so just like the epigastric, right? This time you want to hear sounds when you push air. You can use a partner to do this. Have them push while you're listening, or if you have good hand technique, you can do both at the same time. So you're
That's to
listening.
make sure you're in there.
You're in the right placement. Okay, so you want to hear epigastric sounds, right? Not in ET tube, you don't want to hear those things, but in this one, this is where the placement you want it down there. So you're gonna listen, put your ears on, put it over the epigastric spot, and then you're gonna push the air. Okay, when you push the air, you're hearing gurgling, slushing noises, and then you can even draw back a little bit too, and then maybe there's some stomach contents that come out too. Okay, stomach contents will be like stomach acids, yellow bile, stuff like that. But mostly you'll see those things when you hook it up to suction. So after you do that, you confirm like, hey, it seems like I'm in the right spot. I'm gonna recap it. That way there's more power to the suction when you hook it up and air's not leaking out here when it's trying to suction. But just recap it. You can even use this cap up here if you want when you take it off, put it here. This cap is gonna be for your suction. You're pretty much just gonna hook up your suction here. With that, you'll take that French tip off of it, hook the suction up, and then you'll turn it on, and then you'll leave it on passively as you're bagging the patient. You don't always have to keep it on the whole time. The purpose is just to eliminate the prolonged bagging of the patient, right? There's going to be air leaking to the abdomen, so when you think it's necessary, you'll turn it on. On the ambulance, what do we have that can help regulate pressure? Pressure.
Heat.
Yeah, there's just a dial, right? There's a pressure regulator for the vacuum pump itself. So when you hit the switch, turn on the vacuum pump, and you hook this up to your home suction, there's a little dial that has a pressure setting. It's usually set to max 100. For kids, you kind of want to you want to titrate where you necessarily need around halfway, work your way up, just because kids can be overstimulated a lot easier. So that's it. And then pretty much any questions on this? Any contraindications for the skill itself?
Facial trauma for nasal.
Yeah, so severe facial trauma, and then one more.
Pediatrics.
Oh, known esophageal.
You can do it on pediatrics.
disease.
Yeah, known esophageal diseases such as like varices, and then you have the tears of the esophageal wall like Boerhaave syndrome, Miller-Wise syndrome, that can be contraindicated. So that's if they're known that you don't want to do this skill on that patient.
How do you feed it the nasal cavity if they're unconscious? You just throw it in there and start.
Yeah, I mean, necessarily you won't be doing it on conscious patients, right? The biggest indication for me is when we're bagging them for a long period of time, then I'm gonna think about using one of these because I know from bagging I can cause gastric distension. If they have gastric distension from whatever reason, maybe there's an obstruction or something that I can't see, you can try to get one of these in there, but it's the same way. It's the book says to like drink water. They'll have their patients drink water while they put it through it. That way it just helps flow the tubing down itself. But we're not gonna do that, right? We're not gonna just put an unconscious patient a couple
So you have an
hours
ET
in.
tube and then you